We're all so busy living our lives. And then suddenly something cuts through that, something often very unexpected.
Pediatric trauma call, 15 minutes.
A 71-year-old female with 2 stab wounds to the back.
He was found to be in traumatic cardiac arrest.
I can't feel any pulses. We're at St George's Hospital in Tooting.
Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of Britain's busiest A&E departments, under more pressure than ever.
So do you want to watch, darling, or do you want to look away?
This is the worst day ever.
You never know what's coming in, and you just have to be ready for anything.
Gas canisters exploded, 15% burns to hands, face.
In a world of uncertainty, we see a life-changing event.
I'm A&EP, I need her to get out of here, please.
When patients come in, something takes over.
I'll be fine. I'm going to be very fine.
A place where life,
Give me an A, give me an E.
love,
Okay, good lad, well done.
and loss unfold every single day.
Did you enjoy the Queen's birthday yesterday?
I watched the football.
All the patients you're about to see were treated in just one 24-hour period.
Don't worry.
We get to see people who love one another in loads of different ways.
Yes.
And I think you can give someone the best care in the world, but really what they want is to hold the hand of the person that they love and for them to tell them that they're going to be okay.
You're my hero.
A&E, can I help?
Because popcorn's just stuck.
There's 5 that could possibly impact it. You could really try and do it with one of the middle ones, either the top one or the top base one, and see if it will clip it down.
Okay, I'm going for it.
Jackpot.
This has been the best day. I used to be an A&E more often.
Still 2 up there.
Do you want any more of these taken before I finish them?
That's fine. Not really a huge fan of crisps anyway.
Okay, I'm Simin. I'm one of the A&E doctors. I'll be looking after you today. When I was young in Iran, we had an earthquake in my country, and I saw people from Doctors Without Borders. So tell me what happened. What brought you here today? I do remember when they found somebody still alive, the reaction that people had. You could look at the face of medical people and you could see the satisfaction, regardless of how many hours they've been going on. Okay, all right, have a good day. For me, it was an inspiration. And that was the time that I decided that I want to do medicine. Do you mind just having a quick look at number 5? My job is the big part of me. You come to work and you think it's a normal day. And are you feeling feverish at all? And you get people coming with really, really unfortunate stories. They told me you're known to have type 1 diabetes. Sometimes you just need reminders. You get a patient, you listen to their story, and then it clicks that this is something that can happen to anybody. And that's the moment that you think, well, I'm gonna go home today. I'm gonna call and talk to my brother. I'm gonna text my mum.
St George's. Medical trauma. Adult male trauma, 25 minutes.
A 70-year-old man is being rushed to St George's after falling from a boat and suffering an injury to his eye.
Fallen from boat onto face. Wood in left eye.
When you get that initial information that somebody's coming with a piece of wood in their eye, Your first question is like, what are we going to do? How bad is it? Is it ruptured? Is it bleeding behind the eye? Is it just the eye, or is it something more?
The man's partner is travelling in the ambulance with him.
That day, I was doing housework. George had gone out and he rang me to say that he was on his way to the island in the Thames where we can moor our boats. He was going to go on the boat to empty some of the water because it had rained very heavily. And he said, right, I'll be on my way back shortly. Then the phone went again. I thought, oh gosh, what's he ringing about now? I could tell it was George, but it didn't really sound like George. This sort of muffled groan. And he just said, I've fallen on the island, and that was it. And I thought, oh, goodness. I knew something really bad had happened. I just dropped everything and jumped in the car. George must have managed somehow to feel his way down the path on the island and clawed his way along the fence. By the time I got there, paramedics were there, so his head was all bandaged up. There was blood everywhere. It was horrific. I nearly fainted a couple of times. It's like something out of a horror movie.
Yes.
This is George. He's 70 years old. He was stepping off a boat, and as he stepped off, he lost his balance. He fell forward onto some driftwood. He's got a piece of driftwood that has penetrated his left eyelid and into his eyeball. How far, I don't know. He explained that it felt like a pop in his eyeball. He can see through his right eye, no vision through his left eye. He's a taxi driver by trade.
Okay.
All I've done is put a damp patch over where, when you lift it, you'll see.
Thank you very much, sir.
I'm just going to start examining you, OK?
All right, then.
What's your name?
George.
Deep breath in and out. OK, relax back. I'm just going to lower you down. Okay, let me know if breathing becomes a bit difficult.
I was worried. I don't think you look to the future very much in that situation. You just think, what's the damage?
I'm just going to have a look.
Is it near the brain? Has he lost his eye? You just don't know, do you?
Have a look to see whereabout that sits.
Nobody can survive that sort of injury without being badly affected.
It's been 8 minutes since 70-year-old George arrived in resus after falling and impaling his eye on a shard of driftwood.
So, Simon.
Go on. When you want to remove a foreign object, there are a couple of questions that you have to think about. Where is it sitting? What structures are involved?
Is there any saline?
But going a little bit further, you've got the brain behind it.
OK, just keep your eyes shut. Well done. Just see exactly where this is sitting. And any spare gauze at all?
Yeah.
It's just about to come off. OK. Well done. So it was above, it was basically on the eyebrow rather than the globe. Now, are you able to open your eye? Good.
Yes.
Now, as you do that, I'm just going to have a look.
You have got somebody, they're in an unfamiliar environment, they're lying flat. You think that what's happening is you losing your eye. I would imagine that's really a scary thing.
It's just kind of bruising and blood laterally. Sorry.
And the only face that they see is your face. as somebody who is treating them. And the message that you want to convey is that you're safe, you're in the right place. Big laceration. So I'm just going to get a scan, and then we take it from there.
Doctors are concerned that George may have internal damage to his skull and eye and are sending him for a CT scan.
People ask how we met a lot. We met in a pub in Teddington. I was 50 and he was 53. He said he was 52, but soon got to the bottom of that. It was just a little pub night. It was very jolly and it was a bit like a little party, really. And suddenly, George walked in and he looked very out of place. He was just very different from everybody who was there. And I just saw this huge blokey bloke walk through the doorway with a sort of battered face. He just stood in the threshold and glowered. And I thought, wow, you know, what a bloke. Yes, I had such a presence. I think I fancied him a lot more than he fancied me. And so I walked up to him. I had had quite a bit to drink, so I was sort of quite uninhibited.
Breathe in and hold your breath.
We started talking, and I realised George was a London cab driver, of course. That sort of really was iconic, fantastic. I'd never been out with a cab driver before. Not only does he look like one, but he is one. And he drove me home in one.
Ready, steady, slow.
After I was divorced, I used to think, oh, you know, I'm never going to have companionship. I was completely on my own. I had a nice life, but I didn't have a relationship. I found that with George.
This is one of the healthiest waiting rooms I've ever seen. It's kind of terrifying in a way. Just everyone looks okay.
59-year-old Debbie has come to A&E with her husband Stephen after cutting her hand on the blade of a lawnmower.
I'd like to give them some new curtains. I think they deserve that.
Plastics registrar Dr. Vincenzo is looking at her x-rays.
My name is Vince, I'm one of the plastics registrar working at St. George's. Can you tell me, please, how did it happen?
Complete and utterly my fault. Mowing the lawnmower started to get jammed, and I put my hands to try and unjam it. I thought I was going to pass out.
Do you mind if I take a look?
Of course.
Is it really painful?
No, I was wearing 2 pairs of gloves. I like to make my garden look nice, and I love gardening. I absolutely love it. And mowing the lawn has always been my job. That is one of the things I won't let Stephen do. He doesn't make straight lines, he misses bits out, and that drives me crazy. I was mowing the lawn, but I wasn't really thinking about mowing the lawn. I was thinking of my son's wedding, whether my pink hat matched the rest of my pink outfit, and whether pink was right anyhow. There's so much to think about, and really, I wasn't even preparing the wedding.
I want to check if the sensation is fine, everything.
Yeah, sure. Steve and I met up on my 18th birthday party. I can remember, and I had a couple of boyfriends there at the time, but this lovely Stephen came along, and he'd been on a pub crawl with somebody else, and he sat on our fridge freezer chatting my mum up. And my mother thought he was fantastic, particularly when he got the vacuum cleaner out and started hoovering up at the end of the party. That was it.
Can you feel my finger touching?
Yes, I can. It's just not as good as that one. I mean, I think I was really lucky. I'm a really active person, you know. We're competitive ballroom dancers.
Oh, really?
Yes. So the thing is, with this hand, normally, in a hold, you are like that. We've been dancing for 12 years. So we dance ballroom and Latin. In Latin, you've got cha-cha-cha, you've got samba, you've got paso doble, and they're the best music. Tom Jones, Sex Bomb is a great cha-cha-cha, cha-cha-cha.
Just relax your hand, let me do that.
The competitive dance teacher saw us and said, you should compete. We said, no, we're a bit old.
We will make Bournemouth and we will make Blackpool.
Yeah, we will. We'll see.
You have to really want to dance.
There's a deep laceration, of course, so the wound has to be explored properly. I think you need surgery at some point, because even if the tendon seems to be working fine, sometimes they're partially divided. In that case, you might need to be fixed. I'll be right back.
Oh, darling, I'm so sorry. That was so important to us.
Well, we'll see what you can do with it.
Resus, Simon speaking. Yeah. Go for it. Okay, 8-year-old. Yep. Pediatric trauma call, ETA, 15 minutes.
An 8-year-old girl is being rushed to St George's with a pair of scissors stuck in her thigh.
She's 8.
Also working in Resus today is consultant Reese.
I'm hoping it's accidental. Don't run with scissors. When you hear that a child is coming in with a penetrative injury, my main worry is where is the injury and how did it happen?
The girl's parents are travelling in the ambulance with her.
My daughter, Chantal, came round. Phoebe gets excited. Climbs all over Chantal when she comes and visits. Because she's Chantal's baby sister. We usually sit around the TV and chat and we'd order kebabs. So we wait for takeaway. Phoebe's cutting up some stickers with some scissors, put them in a book. So she puts the scissors in the armchair, but she didn't think they were sticking up. I was in the kitchen talking to Brian, Phoebe's dad. And then Chantal comes flying in, saying, Mum, Phoebe sat on a pair of scissors. She was just screaming, and I'm panicking. I thought we'd gone right through to a vein or something.
My main concern is significant injuries that could be life-threatening. I think it's really difficult when parents have to hand that control over to us as the medical team. Okay, hold on to your teddy, darling.
1, 2. Okay. Phoebe was playing on her own and screamed out to get Mum. She had the scissors in situ.
Do you want to watch, darling, or do you want to look away? It's really important to keep a child calm when they're in the Resus environment because it's so frightening for them. Some children actually say it's better to watch because then they know what I'm doing. But some children say, actually, I don't want to watch and I'd rather look at Mummy.
Mummy, I'm scared.
I know, okay. Darling. You know it's okay to be scared? Yeah? Well done. All right, princess, you don't need to see this bit. You just need to see me.
I don't want to watch.
So it's like 3 centimetres in.
You're going to take him out?
No, we're not.
I'm going to want to do an X-ray to see where it's going, and then we're going to arrange for us to take it out. And we're going to... You won't feel anything, no. The first question that I'm asking is what sort of important structures are surrounding the area where that scissors is going? So if the scissors are deep, then I'd be much more worried about internal injury to maybe the vessels or some of the nerves.
Earlier today, London cab driver George arrived in Resus with a piece of wood lodged in his eye after falling off his boat. His partner Irene has been waiting in the relatives' room.
Hello.
Sorry, I wasn't looking for. So that we just wait back to the report. I do remember being that family member not long ago. I received this call from a number I didn't know, and they told me that my brother has been in an accident. After that experience, what really stayed with me is that you have to realize that your patient is not the only person you're looking after. There's a sister, mother, or partner. Sometimes they just need to talk to you, talk about like personal life of that person, and suddenly it changes everything. That's not just a patient anymore.
I'll leave you, will you?
No, I won't leave you.
Or dramatic.
George grew up in Pimlico, central London, post-war. He was one of 10. He was the 7th son. I was brought up in southeast London, typical sort of suburban childhood. Had an older sister. When we were young, George and I were completely different people. He was a mod, rode motor scooters. I preferred sort of drama students and people with long flowing hair. I certainly wouldn't have been attracted to mods because they wore sort of dinky little suits and had little mod haircuts and everything was tiny. Spivvy and dandy-ish, wasn't it, I think, if you were a mod. Me and most of my friends, you know, you'd sort of wear spinach green and thick tights and camel coats that were belted and tried to look very soulful and poetic. What rotten luck. George and his friends, of course, they were in central London and they all seemed to be doing extremely glamorous things, going to all the dance halls and palais. I would go to the Lake District and go to the New Forest camping and that sort of thing. So I think I would have been very fish out of water if I'd known George then.
Oh, great. But it's just something just to wet his mouth.
Oh, lovely. Thanks awfully.
No worries.
Got something to wet your mouth a little bit, George. I think sometimes it's easier to have a relationship with somebody where initially you might feel your poles apart, but then actually you realise how much more you've got in common, and it's quite nice as you do that. And we've always enjoyed doing the same things. If it's still feeling cold. We belong to a boat club, and we did the day skipper course there. Does that feel better?
Whatever you do to me feels.
We like to drive over to the island, where he's got a mooring. It's like walking into another world. We pop down there quite a lot in the evenings. Time just goes by, the river flows by. It's a little oasis of tranquility, it's just lovely. Is that better?
Simon?
Yeah?
Can I just check with you? Just max facts, or would you look?
Doctors now have George's CT scan results. They reveal internal bleeding behind the eye.
Hi there, my name's Dr. Carrie. I'm one of the A&E doctors.
Oh, yes, hello.
George, I've just been asked by one of the specialist doctors to just do a couple of things to examine, just to give them a little bit more information.
Yeah.
So just going to take that gauze off. OK.
Imagine that you do have bleeding behind your eyeball.
Open your eye the best you can. I want you to look over towards me.
It's a closed area. It's not going to expand. So the pressure is going to go higher and higher.
So look round at me.
Yeah.
So look right over towards your nose.
If it's not addressed quite quickly, that will affect your vision. Is this person going to lose his vision?
Does it feel like your eye's being pushed forward?
Yeah.
Have a seat, mate. So, what have you done?
I've stepped on a glass in my bedroom. I've just knocked it over, stepped on it, and then I've fallen into my TV and broke my TV.
Fragile tape. I've never seen that before in 28 years.
I don't know why we've got fragile tape. It's quite cool, isn't it?
Very cool.
Yeah.
59-year-old Debbie has come to A&E after sticking her hand in her lawnmower whilst removing some grass cuttings.
Why did I do it?
Just happens to everybody.
Dr. Vincenzo will explore the wound to assess the damage.
Just a couple of injections on the base of the finger, both of them. Sorry, ma'am. 1, 2, and 3. Apparently from the X-ray there's a fragment.
Yes.
So there's a fracture on the middle finger now. So the nails have to come off. Yeah. Yeah. They will grow back, but it will take some time.
I'll wear false nails, don't worry, light false lashes. Although I came from a very happy household of 4 girls, I was absolutely delighted when I had 2 boys. They were real little tearaways and they just wanted to explore and run and be what little boys are.
I have a very busy week with a wedding ahead.
So wedding next weekend?
Yes, my son.
Tim is 36, so he wasn't getting married as, you know, a 22-year-old. As you get to the planning stage, it was very exciting, as all weddings are.
If you have any lack of sensation after surgery,
Yes.
they might take a few months before he comes back.
My youngest son, Simon, he was going to get married and go down the traditional route as Tim, but he didn't. Things changed. If Simon had played with dolls or done something that was very feminine at a very early age, then maybe I would have been slightly prepared. Simon transitioned about, I think, 4 years ago now, although fully transitioned, I think it's only a couple of years ago, and is now a girl. So instead of Simon, I have a daughter, Sophie. I can't say that it wasn't a shock to our system. It was. To both Stephen and I, it was out of the blue. We hadn't expected this. And it has taken time for me to adjust. I don't think I can put into words, without crying, how much I have had to appreciate the struggle that Sophie took. I mean, there could not have been a bigger challenge that any one man could say or take.
Eight-year-old Phoebe has been in resus for 25 minutes after accidentally impaling her thigh on a pair of scissors. Her mum and dad are joined by Phoebe's older sister, Chantel, and her partner, Reese.
There she is.
You're still in there?
Yeah.
We can't use them ever again now.
Well, no, I'll be put off life, I have.
Orthopaedic doctor Ishan must rule out any damage to the nerves in Phoebe's leg.
Hello. Hi, I'm Ishan, one of the orthopedic doctors.
What's gonna happen, Mummy?
I'm not going to touch you even. Just ask you to do a few. Can you move your toes for me? Excellent. So come around that.
I'm a mother to 5 children, 2 sons, 3 daughters. I wanted to be like my mum, have a big family, I did. I always have been maternal. I was 17, still living at home when I fell pregnant with Chantel. Because Phoebe's the youngest, she's a little monkey. She's always on the go, very active. It's a hectic lifestyle.
Can you feel me touch here?
Got a 3-bedroom house. I've got Samuel and Liam living at home, and I've got Phoebe living at home as well. And each child has their own room. I'm not going to be one of those people that go ask him to cancel for a bigger house.
Mum, I'm so scared. What's with me?
Me and Brian sleep downstairs on the sofa bed.
Good girl, Phoebe.
And we just put up with it. It's not comfy, you know, putting it away, bringing it out every night, and it's just constant. But I won't change it. I love being a mum.
It's going to keep you like that. We're not going to move you. I'm going to take an X-ray, okay?
Doctors must now X-ray Phoebe's leg to see how deep the scissors have penetrated.
Ten years ago, I was all happy, thinking I found my man of my dreams. I felt pregnant. You know, thought it was all going to be a happy family. And then disaster strikes. I got to my 20-week antenatal appointment, and they said they couldn't find a heartbeat. She said, you're going to have to be admitted to hospital. When I got to the hospital, there was no heartbeat. It's been 10 years since I've lost him. I got a chance to name him and have a good send-off for him. Yeah, we called him Nathan, we did. But when the months went on, I thought, I'm not going to be able to have another baby. And then, 8 months later, when I found out that I was expecting again, I was happy, but I was scared at the same time, thinking, is it going to happen again?
Taxi driver George arrived in A&E after falling out of his boat on the Thames and impaling his eye on a piece of driftwood. His son Paul has arrived.
He's recovering, mate. It's okay. It's like a professional carer in there.
Does it look good? When you mention that George is a cab driver, people know what you're talking about. And they already have an image, and he is very much what people have in mind. He is a typical cab driver, I suppose.
Look like a proper pirate now with an eye patch.
Say, yeah. One of the nice things about cabbing is that in some ways it's still very much as it was 40, 50 years ago. You're still picking up strangers, and you've still got a certain reputation and credibility. He gets up really early. He just creeps out of the house, and I hear the cab, and hopefully it starts, and then I hear him disappear up the road. He works at the airport, and I understand that while they're waiting, there's a canteen, especially for the London cab drivers, and they sit there and play cards, tell jokes, have bets. I think they just have a laugh. They really enjoy each other's company. And occasionally, if they're lucky, they get a couple of fares. It's very important to him, and that's his life, really. If he lost his ability to work, I think that would be devastating for him.
Specialist Dr. Lino is examining George's CT scan results.
Hello, hi. Hi. George?
Hello.
George, it's Lino. I'm one of the surgeons.
Yeah.
Just had a look at your scan. Basically, I can tell you there is a small fracture on the floor of your orbit, or the bony socket, okay, of your left eye.
Yeah.
And there is a slightly larger one on the side. This means that you will need to be seen by an eye doctor, but we want to see first how's the eyesight going. move your eyes, sir? Is it very painful?
Yes.
Yeah, right. So is it very sore if I touch you?
Yes.
Right.
My brother had a car accident, and his injuries, they were mainly facial. He had to go through so many surgeries. Facial injuries, they're kind of linked to your identity. One of the things that he couldn't get over that easily was that he couldn't get used to his new face. He was telling me, I look in the mirror, I don't know this person anymore. It's a huge amount of adjustment. And simply that means that your life is not going to be the same.
Sorry, I just need to stretch a bit more up.
I think that's human nature. You think that you're in control without realizing that sometimes it's not just you. There are other things that you cannot control. You had it all planned and now everything is changed.
And how is your eyesight? Do you think it's getting worse?
My eyesight?
Yes, from this eye. If I pull your eyelid a bit up.
Yeah.
Can you see colors?
No. Not really, no.
Right.
Lots of people say you can manage with one eye and you can drive with one eye. You can't drive a cab with one eye. And I just thought, gosh, how is he going to cope if he has lost the sight of one eye? I don't know.
Can you see the colour?
Flashing you.
Yes. Can you see lights?
I can see your head. I don't know if you got a glove on or not.
He might stop being the George as I knew him and relied on him really as always being forthright, loud, able to sort out situations. He might not be quite the same again.
I'll put this small gauze on top again, okay? Just very, very gently.
George will be taken to a ward where specialist doctors will monitor his eyesight ahead of surgery.
Right, do you want to have a look?
It's quite nice work, isn't it, Craig?
Yeah, it's pretty good, I hope.
It is good. Craig is literally, I'm going to write him the best review.
I don't think they have TripAdvisor for, like, for doctors.
If you go into Tooting, St George's, see Craig.
Request Craig.
Well, I think I'll deserve a glass of wine when I get home.
I think what I'd like is Marmite on toast.
Tonight? OK, yes, that's good.
It's my favourite.
OK, fine.
Hello, hi there. We're just going to come and put a little dressing on there.
Oh dear. Okay.
We're going to have to take the nails off.
When they fix it up tomorrow, yeah. It looks like it's right through to the base there a little bit.
I've got a wedding for my son. I gave birth to a Simon, but I have a Sophie. There was a process in order to find the positive side to it.
Sure. Okay. Sorry about this.
Yeah, that's okay. Although I still make slips with the name and, you know, it is still something I think about. I'm totally happy. We go shopping together, we have lunch together.
Go get you some other little goodies there.
Thank you very much. I haven't fully understood it. I don't think I will ever fully understand. As long as I fully understand my Sophie, that's all that really matters to me. But I think that actually it's important that you accept.
It's always been different. No, it's OK. Part of the reason I married you.
I think through your lives you need challenges. And Sophie has been one hell of a challenge to me, but I love her dearly for it. Thanks. You know, I was his mum, and I'm her mum now. So, you know, there has been a big change. but I'm still mum.
Phoebe arrived in resus with a pair of scissors embedded in her thigh. X-rays reveal that they have not penetrated the bone or arteries, and it's safe to remove them.
Finally! Have I been so long? Have I been ages? It's been very busy here tonight, that's why. We might actually put you to sleep down here and take it out down here and wash it out down here.
What if it starts pouring out of blood? Would you wash it up in there?
Yeah, we're gonna wash it all up for you. Do you want to keep the scissors?
Put them in the bin.
I think you'll be very careful with your scissors from now on, won't you?
I didn't know I put them there.
You're forgetful. What's your name?
Phoebe.
Not that forgetful, are you? Do you know what I like to do with my children in the hospital? We like to do fist bumps here. You do me fist bump? Yeah, good girl. Just rest, close those eyes, and think about something nice. Yeah, good girl. You've been amazing, okay?
Love ya. I'm scared.
I know, baby.
They're going to take it out.
Yes, I'm going to give you some oxygen to wear. We're going to give you some sleeping medicine. So I need to...
Mummy. Mummy's here. Where's Mum? Yeah.
Be all right. I fell pregnant with Phoebe. In the same year, I lost Nathan.
Let's have a little look at your thigh now.
And I found out I was expecting. I didn't tell Brian until he got in from work.
Are you in pain still?
And then when I finally got to 20 weeks with Phoebe, and they said, healthy heartbeat, I cried, actually. I actually cried when I knew she was still with me.
Yeah, that's fine. That's good.
She was so small when she was born. 6 pound, 9 ounces, awake early. From that moment, she let out that little cry and then straight to my arms. It was just a strong bond. I always call her my miracle baby. It's my little miracle. I just don't want her to grow up too quick. Best thing ever being a mum.
Phoebe will be taken to a ward for observation to make sure there is no further damage to her leg.
It was just a fabulous affair, and it was a great excuse for the family all to get together and to be together.
When I hurt myself, I mostly wanted my mum. She never left me. It teach me a lesson not to play with sharp things now. I spend loads of time with my mum. I love her. She's the best mum in the world.
I remember George saying, I don't care how long it takes to get better. I can't work for several months, that's fine, but I would like to have some sight in that eye. I was thinking, I'm not sure whether life will really get back to normal again. But I thought as long as he gets a bit of sight back, that would be great. but we didn't hold out a great deal of hope.
As long as I can work, I will. I don't want to retire. I want to be the oldest living cab driver. And don't ask me how far I've got to go to do that. They can put that on my headstone or something. See you later, my love.
Should you have a selfie while we're sitting here?
Oh, come on then. Hello, St George's. Skull fracture, C1 fracture, T4 fracture, rib fracture, facial fractures.
It just goes to show how easy it is for an experienced builder to slip up.
He's fallen down some steps and broken every bone in his body.
It takes a second to make a mistake, and your life's changed forever then.